Hello, good evening, folks. I hope you're having a great night and are getting ready for a festive Halloween and relaxing weekend. My name is Spencer, and I'm an advisor to the Center for Health and Democracy. We're going to give it a minute while some folks continue to join. While we wait, if you could please put your name and location in the chat, I'd love to see where folks are joining in from tonight. Would love to give some shout outs. I already see a few familiar faces, and plenty of new ones too. So good to be in good company. Who's going to be bold and put, okay. Hello, Martha Livingston from New York City. Nice to see you. I think we've connected a couple of times before. It's great to see you, Martha. I should say I'm Spencer, and I'm an advisor with the Center for Health and Democracy. And I am based in a town called Superior, Colorado, just right outside of Boulder. So glad to be joining tonight. I see a few more folks joining from the waiting room. Give it just a moment for some more folks to join. I'm happy to say that we had enough folks RSVP that we reached our RSVP limit for this call. So hoping to be joined by a lot of friends from all over the country tonight. All right, let's see who else we have. Oh, we've got so many. Oh, look at this. So many folks. Okay, we got Chuck from Tampa. We got Susan from Olympia, Washington. Olga from Vegas. Angie from Austin. Dr. Ed Weisbart from Missouri. Hello, nice to see you, Ed. Laura from New York. Couple folks from Texas. Jessica and Kathy and Jeff, all from Texas. Nice to see it. Dale from Sacramento. Hello, Dale. Claire from Everett, Washington. Hi, Claire. Maria from New Jersey. Ken from San Diego, jo Joni from Lafayette, California. Hello, Joni. Apologize if I'm mispronouncing that. All right, hello, folks. Appreciate you, appreciate everyone being here today. Your time is very valuable to me, and we have a packed agenda for our meeting tonight. So I'm going to go ahead and get things started while more folks continue to join. For those that are just joining, again, hello. My name is Spencer Carnes. I am an advisor to the Center for Health and Democracy. If you haven't already, please put your name and location in the chat. I would appreciate it. So tonight's meeting, the purpose of tonight's meeting is that we have an opportunity to start talking about a very exciting campaign that gets at the core of corporate greed in our healthcare system. Um, so I want to say right now, before I forget, that after tonight's call, we would love to connect you with other people on this call who are in your state or who are maybe in neighboring states. So throughout the call tonight, I'm going to ask that if you consent to being connected with other people near you by email, please put the number one in the chat. So if you know right now that you see some friends on the call and you want to get connected by email, I see Jessica and Chuck doing it. Okay, nice. Lots of ones coming in. But yeah, if you're okay being connected with other folks, please put a number one in the chat. I'll save that and connect you all probably tomorrow. If not tomorrow, definitely by early next week, we'll get you all linked up together. Um, again, tonight's meeting is we're going to be talking about the Center for Health and Democracy's work on vertical integration and consolidation in healthcare. We're going to take a look at how one of the biggest, actually the biggest healthcare company in the world, is doing everything they can to control every part of the healthcare delivery supply chain. First, we're going to hear from the Center for Health and Democracy's president, Wendell Potter. He's going to be talking a little bit about the work that the center is already doing. And then we're going to hear from the center's Director of Policy and Advocacy, Dr. Rachel Madley, who's going to be talking a little bit about some policy specifics, why vertical integration is an issue, how corporations get around the rules that we set out through federal and state regulations. And Rachel's going to give us a little bit of a preview of an exciting bill called the Patients Over Profits Act. She'll also tell us a little bit about the political landscape and the context of that bill. After we hear from Rachel, I'm going to hop back on the mic and I will quickly talk about a couple of resources that we have available to activists and advocates such as yourself to aid with campaigning and advancing this bill through Congress. And then this is going to be, I think this is going to be the best part of this call. We're going to send you into breakout rooms. When you RSVP'd for this call, you told us what states you're in. And so we're going to send you into breakout rooms with other people in your state, or in some cases in neighboring states. California and New York, since you had so many RSVPs, we're going to split you up geographically. So after we do breakout rooms, we will come back for a little Q&A. I'm hoping that we have about 10 minutes at least for Q&A. And then we'll close out with some next steps. So I hope that agenda all sounds good to you. One last thing, everyone is doing a great job of this so far, but if you could, we have a lot of people joining this meeting tonight. So if you could please keep yourselves on mute, I would appreciate it. That way we're not interrupting folks while they're talking. And during the Q&A section, I'm going to ask you to use the raise hand feature in Zoom to say that you have a question, and then I will call on you. So, with that, I am going to pass it to the for Health and Democracy's president, Wendell Potter, to tell us a little bit about the work that is already going on related to consolidation and vertical integration.
Spencer, thanks so much, and thank you all. This is thrilling. I see a lot of familiar faces and meeting some people for the first time tonight. First, let me describe a little bit about what the Center for Health and Democracy is. We are an advocacy organization. We advocate for reforms to U.S. healthcare, largely in Washington, but also at the state level. But we've also been leading the fight against consolidation in healthcare since our founding. We've monitored and reported on the what I call an arms race among big health insurers in particular, and their efforts to control as much of the U.S. healthcare system as they possibly can. Several weeks ago, we released the Sunlight Report on United Health Group, which through thousands of acquisitions that it's made in recent years, has grown to be the biggest healthcare conglomerate in the world. The Sunlight Report was the first ever analysis of the business structure of United Health Group, and what we found after months of research that included a review of obscure regulatory filings was that United Health now comprises nearly 2,700 subsidiaries. I want to stress that United Health is not alone in implementing a business strategy called vertical integration. All the big for-profit insurers are doing the same thing in one way or another. When I was an insurance executive at both Humana and then Cigna over about 20 years altogether, the companies that I worked for and other insurers grew bigger by buying smaller healthcare insurers and merging with each other. That's called horizontal consolidation. Vertical integration means that the same corporation that sells health insurance also owns physician practices and clinics and pharmacy operations and many other parts of the healthcare system. A troubling and worsening issue with our healthcare system is that big insurance companies are more focused on making big profits than on providing access to good quality care to us and our families. I observed that during my time in the industry, and I'm seeing it even more as an outside observer. Wall Street demands that these companies stay focused first and foremost on making money for investors. Health insurance corporations are under unrelenting pressure from their investors to maximize both their revenues and their profits. So when we fight against consolidation, we're fighting greedy insurance conglomerates that are on a never-ending quest to control more and more of the healthcare delivery system. Now back to United Health. Here are some of the highlights, some of the things that we uncovered from our research and analysis of the company's regulatory filings and also from financial disclosures. Uh, More than 75% of United Healthcare's revenues now come from taxpayers in one way or another. United Healthcare is the insurance division of United Health Group and is the biggest player in the lucrative Medicare Advantage program, and it also manages the Medicaid programs in many states and even a big part of the healthcare program for veterans. United Health Group last year reported total revenues of more than $400 billion, dollars, making it the third largest corporation in America. Only Walmart and Amazon are bigger in terms of revenue. United Health's health plan division alone brought in $295 billion dollars in revenues last year. Of that total, about $213 billion, and probably more, came from U.S. taxpayers. As I noted earlier, United now comprises 2,700 different subsidiaries spanning across all parts of the U.S. healthcare delivery system. You might think of a company like United as an insurance company. That's what most people think of that company as. But in 2024, its non-insurance division, Optum, actually generated more profits for the parent company than its insurance arm. Optum in 2024 had generated profits of nearly $17 billion, dollars, and United Healthcare, the insurance arm, contributed $15.6 billion. Dollars. So you see, they're actually making more money for investors as they gobble up more and more of the healthcare delivery system. The way United Health is structured, it's now able to self-deal on a scale that has never been known in healthcare before. Essentially, the insurance arm is able to steer more and more of its health plan enrollees into healthcare delivery operations that are part of Optum. Uh, Folks, the U.S. has regulations in place that prohibit intercompany dealings like this in banking and other parts of our economy. So why not healthcare? So with that, I'm going to hand it over to Rachel Madley, our Director of Policy and Advocacy, who will walk us through some of United's biggest subsidiaries and why this all matters. Rachel?
Thanks, Wendell, and thanks everyone for joining. It's really exciting to be with all of you tonight. I am first going to talk about what does the size of United Health Group mean for a patient who's trying to navigate the healthcare system. So I'm going to share some slides so that we can walk through it together because knowing that um, there is so many subsidiaries here can be overwhelming for patients. So can you see my slide switching?
Rachel, I actually did not see your slide switch.
Okay. So I'm just going to do it on this window then because it pauses when we go to full screen, but everyone should be able to see. So healthcare has obviously been in the news a lot lately with the shutdown, with the devastating Medicaid cuts, with the potential expiration of the ACA enhanced premium tax credits. We are seeing a lot of people talk about the cost of healthcare even more so than they have been. There have been social media posts from folks at American Economic Liberties Project, like we have here, talking about, healthcare costs are skyrocketing. Where is all this money going? Because we, as people, as patients, know that we are putting more money into the system, but it seems like we're getting skimpier coverage and paying more out of pocket. So, in response to this tweet, you had Mark Cuban, who does a lot of work in the healthcare space, specifically with cost plus drugs, but he highlights that insurance companies and their subsidiaries have found ways to manipulate the system. And that's really what we're going to talk about tonight. So, back to a patient's journey. Let's say you are a hypothetical patient who is wanting to find a doctor. Many of you have probably used the website Healthgrades before. I view it as the Yelp for doctors. So it has medical provider reviews, information, so that folks can find a healthcare professional when they need one. The website says that over half of Americans who saw a doctor last year used Healthgrades. Looking at the website, there is no way to tell, but in our report, we actually found that Healthgrades is a run by a subsidiary of United Health Group called RVO Health. So again, right off the bat, when you are entering the healthcare system, you are being steered by United Health Group. Now, let's say you found a doctor, you're going to visit that doctor. There is a 1 in 10 chance that the physician that you are seeing is employed by Optum. Optum is the medical provider arm of United Health Group, and they employ 1 in 10 physicians in the United States at this point, and that number is growing. Now, on the slide, you will see different names and signs of clinics. I put those here because those are actually names of subsidiaries of United Health Group. So those are physicians who are employed by United Health Group and Optum. But again, looking at that name, American Health Network, you cannot tell that they are a subsidiary of Optum. So again, as a patient, you are having your healthcare journey affected by United Health Group and you may not even know it. So after you see your medical provider, let's say they suggest a treatment for you or they diagnose you with the condition, many of us will probably go to the internet to read more about that, learn about what our physician has told us. And one of the top hits often when you do that search is Healthline, which is pictured here. Healthline is owned by the RVO Health subsidiary again. So this is information that looks like it's an unbiased resource of medical information, but really it is published by United Health Group through one of its subsidiaries. Now, next, let's see, you need a treatment. based on your diagnosis from your medical provider. If you are one of the very large population that has United Healthcare as your insurance, you are likely going to be put through the ringer trying to get the treatments that you need. United Healthcare is well known for requiring prior authorizations, or essentially requiring your medical provider to submit a permission slip to them to give you the treatment that you need. Often these prior authorizations are denied, and sometimes people have to go without the care that their doctor prescribed because the prior authorization was denied. Even if the prior authorization is approved, this process leads to a delay in care, oftentimes leading to more harm for patients. United Health Group also has a subsidiary called NaviHealth. NaviHealth is a platform that is, they claim, innovating on prior authorization. And the important thing to know here is even if you don't have United Healthcare as your insurance, other insurers are starting to use NaviHealth to process their prior authorizations. So, again, even if you don't have United Healthcare, United Health Group has a big effect on your healthcare journey. Let's say you need a prescription. Millions of people in the United States have pharmacy benefits that are managed by Optum Rx. You have likely heard about pharmacy benefit managers, or PBMs, in the news. They are essentially a middleman. And on top of the rebates and price gaming that they are doing, as a patient, a lot of times they will require what is known as step therapy, which is when you are required to fail first on a cheaper drug before they will approve the more expensive medication that your doctor prescribed. Again, this is delaying the course of treatment that you need and often increases the harm and sometimes pain that a patient will feel because they have to fail first on a drug before they can get the prescription their provider wrote for them. If you are a patient or a caregiver and someone you are caring for needs care in a nursing home, this is another place where United Health Group will have a big effect on your healthcare. So you may have seen there was a recent report that United Health has secretly started a program with nursing homes where they put providers who are employed by United Health into hospitals, and their purpose is to try and reduce hospital transfers. In the article cited here, this happened in cases where patients were showing very clear signs of potential strokes, and hospital transfers were delayed because those patients had United Healthcare as their insurance. And a transfer to the hospital and treatment in a hospital is much more expensive than staying in a nursing home at that point. It was also found that sometimes these United Health employees would counsel patients who had United Healthcare insurance and try to get them to switch their status to do not resuscitate, or DNR, which means that if their heart stopped, they would pass away and no medical intervention would happen. This is a lot less expensive than if a patient is full code status, which means all medical interventions will be undertaken to save their lives. So again, even if the nursing home is not owned by United Health Group, it is still affecting the patient's journey there. Let's say you need home care either after the nursing home or in place of a nursing home. United Health Group owns a lot of subsidiaries in the home care industry. Similar to their medical clinics, it is very difficult to tell if a home care entity is owned by United Health Group because they have names like Almost Family Personal Care, which does not sound like it would be part of the United Health Group conglomerate. So even if you are trying not to have United Health Group controlling your health care and journey, it's very difficult to avoid that. Next, for a smaller subset of folks who are veterans and eligible for VA benefits, they are also interfacing with United Health Group in two different ways. The first is that Optum has a subsidiary called Optum Serve. OptumServe administers the Veterans Community Care Network for half of the country. Now, this is essentially the program that allows veterans to get specialized care outside of the VA if their care isn't available at the VA. Reports have shown that Optum is doing similar things to what they do in Medicare Advantage in the VA through this program. That includes overbilling the government for procedures, double billing, and this is amounting to billions of extra dollars being paid to Optum from the VA. You will also encounter United Health Group if you are a veteran because you will likely be the target of advertisements for their Medicare Advantage plans that they claim are tailored specifically to veterans. These plans, they call them the Patriot Plan, and one of the names is right here. The plan seems great. It seems like it's tailored to a veteran's needs, but what is really happening here is that United Health Group figured out that if you have VA benefits, you are likely getting a large majority of your healthcare at the VA within that system. However, if you enroll in a Medicare Advantage plan, the health insurer who enrolled you in that private Medicare plan still receives the full payment from the government, even though they're not having to pay for the medical care of that veteran. So here, United is really double dipping and just getting more and more taxpayer dollars that they should not be. The last step on the patient's healthcare journey where United Health Group comes into play is your data. So let's say that you are able to avoid United Health Group through all of these other steps. The subsidiary Change Healthcare, which many may have heard of after the cyber attack a few years ago, the Change Healthcare is responsible for payments from insurance plans to providers for virtually every health insurance plan across the country, or they are at least involved in some type of data transfer. So again, even if you avoided United Health Group in the other steps of the patient journey, your data is likely going through Change Healthcare at some point in this journey. So as you can see, the healthcare system is more like United Health Group land. And the one thing that I want you to take away from this is at every step where United Health Group is intervening on the patient's journey, they are making a profit. Whether it is the health insurance arm, where we know they are denying care so that they can keep more premium dollars, whether it is OptumServe with the veterans benefits, where they are getting overpaid by the government, they are making a profit at every single step here. Now, I want to talk about something that really drove this vertical consolidation, and Wendell touched on it a little bit in his introduction. This is called the medical loss ratio. Now, bear with me, I know this sounds very policy wonky, but the medical loss ratio is a requirement that health insurance plans spend 80 to 85% of your health insurance premium dollars that you're paying them on medical care or quality improvement. So this is supposed to make sure that health insurers are not profiteering and they are paying for the medical care that we need. And the Affordable Care Act is what really set this minimum medical loss ratio requirement. This only applies to health insurers. So the reporting requirements for how much money is being spent on medical care versus profits only applies to health insurers. Now, what United Health Group and other large health insurers have done is they have acquired all of the downstream healthcare entities like a physician's office, like a PBM, like a pharmacy. And what they're able to do, and reporting has shown that they do this specifically in physician practices, is they will pay higher amounts from their health insurance arm to the medical provider arm because as an insurer, they get to report that inflated amount as money they spent on medical care. But really, they're just moving that money from the insurance arm to the provider arm, and then they get to keep that inflated amount as profit. So vertical integration is a key way that United Health Group and other large health insurers are avoiding the medical loss ratio requirements and really getting away with not spending the premium dollars that we are trusting our insurers with on our medical care. And so I think that's really important to understand. And there are a few terms that you might come across if you're doing some more reading about this. Um, Transfer pricing is what I was talking about, where you're paying more to a provider to make it look like that money was spent on care. On their filings, United Health Group calls the transfers of money that they pay from one arm to another, so a payment from United Healthcare, the insurance arm, to Optum, the medical provider arm, is called intercompany eliminations. If you look at this, the proportion of their profits and revenues that are intercompany eliminations have been steadily increasing essentially since the Affordable Care Act was passed. So you can see this happening. This also reduces competition because, again, so many of the pieces of United Health Group are touching the healthcare system. And if you own every part of the healthcare journey, there is no motivation to lower costs because the higher the cost, the more money you get to keep as profit. So with that, I'm going to stop sharing my screen. I know that was a lot of bad news. So now I'm going to talk about some good news. The good news is that there has recently been a bill that was introduced called the Patients Over Profits Act that would get at the heart of this problem. The Patients Over Profits Act would prohibit a health insurance issuer from uh, owning a medical provider. So a Medicare Part B or C provider, which is again a policy way of saying you cannot own a medical provider. This cuts that tie. It stops the gaming of the medical loss ratio between insurance companies and medical providers and really gets to the root of this problem. It will also help stop the vertical consolidation that we are seeing throughout the healthcare system and undo it because the bill does require companies like United Health Group to divest of either the insurance piece or the provider piece. The bill was introduced in the Senate by Senator Merkley, and it is co-sponsored by Senator Warren and Senator Markey. And on the House side, it was introduced by Representatives Hoyle, Ryan, and Jayapal. And since then, Representatives Ocasio-Cortez, Connett, and Ballot have signed on as co-sponsors. Now, we're very excited about this bill because, as Wendell mentioned, regulations to prohibit self-dealing already exist in industries such as banking. It's time that they exist in the healthcare industry. In terms of outlook for this bill, obviously during the shutdown and the negotiation over the Affordable Care Act subsidies, this bill is not getting the main focus. However, at this time, we believe that once the shutdown is over, this bill could be a very important piece of getting towards a better healthcare system because if we don't have something like this and we want to get to a Medicare for all system or another type of transformational reform, this having United Health Group own all of these providers is going to really hurt that Medicare for all system or that other type of system. So this is really a foundational piece to the transformational health reform that I think a lot of us on this call are working towards. I also think that this bill really brings together all pieces of the health justice movement because whether you're working on disability rights and benefits, United Health Group is directly impacting that. If you're working on deprivatizing Medicaid, United Health Group is the administrator of a lot of state Medicaid programs. If you're working on defending Medicare against privatization, if you're working on Medicare for all, United Health Group is taking money that it doesn't deserve from the Medicare Advantage program. So this really unites all pieces of the health justice movement and creates the foundation that we can build upon in the future. Now, one question that's probably top of mind is there bipartisan support? Right now, there is not any Republican co-sponsors of the bill. However, in conversations, we have had very positive feedback from members of the Republican Party. And I will also note that there is a similar bill called the Patients Before Monopolies Act that is co-led by Senator Josh Hawley, who is a Republican senator, and that has to do with prohibiting insurers and PBMs from owning pharmacies. There has also been a lot of public comments by Republican members of Congress about needing to stop vertical integration. For example, Congressman Buddy Carter, in a hearing that he was chairing in the Energy and Commerce Health Subcommittee, called for breaking up United from the dais. So there is bipartisan interest in this issue, which makes it even more exciting that there's a bill here because in the current administration, a Democratic only bill is likely not going to move, but something with bipartisan interest has the potential to move. And this is so, so important to our healthcare system. And so that's why we're so happy to have all of you here to learn more about it. And I am going to hand it back to Spencer to take you through some of the resources that we've created about this bill and this issue.
Thank you, Rachel. I appreciate it. I'm going to be pretty quick in this section because I want to give you all a chance to get to know each other, and then I want to make sure we have plenty of time for Q&A at the end. So real quickly, I'm just going to put in the chat. I should mention we are going to send an email after this call with a couple of different resources, including the one that I'm about to put in the chat and show on my screen. We developed a toolkit for activists with some information and suggestions about how you might encourage your member of Congress to co-sponsor and support the bill. The toolkit is available at c4hd.org/toolkit. Let me make sure. Sorry, I need to make that. All right. The link is in the chat. And I'll go ahead and do a quick screen share to just show you the toolkit. So we put together this toolkit. The first thing I want to highlight is that we want to be supportive of your activism. So throughout the toolkit, it encourages you to get in touch with us by emailing us at advocacy@centerforhealthanddemocracy.org. If you have some creative ideas, if you have questions, if you need help, if you want to get linked up with other people in your area to do this work, please reach out to us at this email address. Other things included in the toolkit are some suggestions on sharing your healthcare story. So often the world of health policy is laden with statistics, stories, which, virtually everyone in this country has a story about the time the healthcare system didn't work for them or a loved one. Stories really help us showcase how important this issue is and it really gives a perspective of the personal impact that corporate greed has on our healthcare system. We also have tips for posting on social media, including some ready-made social media posts. If you're on Facebook, Twitter, Blue Sky, Instagram, we wanted to make it easy for you to be a part of this campaign by speaking out online. We have information about calling your member of Congress. We have a tool to call your member of Congress. We appreciate it if you use the tool so we have a good sense of how many phone calls have been sent to different congressional offices. Also included in the tool, as well as in the script, is a little script that you can use. Feel free to add to it, change it as you like, but there's some core messaging included in there. We have suggestions for meeting with your elected officials or their health policy staff or their chief of staff. The first thing I want to say is if you're interested in meeting with your elected officials about this issue at any point in the next couple of months or over the next year, please reach out to us first so that we can help coordinate that meeting. We can help you plan for that meeting, and we can also help make sure that the other activists in your area and in your congressional district are able to participate as well. And I'm going to scroll down a little bit. The last section in our toolkit is some suggestions for writing an op-ed in your local paper. It's really hard to kind of get op-eds placed in national media right now. That's just kind of the lay of the land. But we definitely think that we can make a difference by writing short op-eds in local papers in order to educate people on this issue. So that's the toolkit. I went through it pretty quickly because I want to make sure you all have some time to get to know each other. I'm going to go ahead and launch the breakout sessions right now. You should get added automatically to your breakout room. For some of you, you're going to be with people in just your state. For others, you're going to be with people in your state and neighboring states. So I'm going to give you 10 minutes for your breakout session. The first thing I encourage you to do is just a quick round of introductions to let everybody know what state you're in and maybe what part of the state you're in. Beyond that, I encourage you to share the questions that are on your mind. I encourage you to share impressions of the bill. I encourage you to think about ways that you might get your senators or your representatives at the federal level to co-sponsor and support this bill. And with that, the last thing I'll say, I've done these breakout rooms with folks before. I know it can be a little awkward getting put in a room with some new friends, but I want to encourage you and like guarantee that everybody on this call tonight is here because we are sick of corporate greed in our healthcare. So you have something in common with the other people in your breakout room, and be nice and be friendly and, keep it PG. I appreciate that too. And with that, I'm going to go ahead and send you into your breakout rooms now. So if anything pops up on your screen saying join the room, please click the join button. Otherwise, you should get added automatically. Okay, I
Okay.
think we
Okay.
have everybody coming back now. Yeah, these breakout rooms can be tricky. Yeah, it's a good opportunity to get to know folks. And on the question of what to do about this, I think it's something that we're still thinking about. Obviously, with the shutdown happening right now, there's a lot going on in Washington, D.C. But we want to have these conversations with you all early because when that shutdown's over, like we want to have an opportunity to really bring this to the forefront of the conversation as the next fight in healthcare. So whereas we're still figuring out exact plans and specifics, like we appreciate you being here tonight to help figure it out with us. We're all done with breakout rooms and presentations now, so we have 14 minutes for Q&A. I'm gonna stop talking in just a moment. Before I do, I know I have one last thing. Okay, a couple of last notes. Again, if you want to be connected with folks that were in your breakout room or who are in this meeting in states near you, please put a 1 in the chat if you haven't already to consent to being connected by email. Also, real quickly, I do want to highlight that the Center for Health and Democracy leads a coalition called the Loop Coalition, which is the Lower Out of Pockets Now Coalition. It's a meeting, it's a coalition of advocates and staff and leaders from grassroots and national organizations, activists who are fighting for healthcare justice and to fix our broken healthcare system. So if you're interested in joining the Loop Coalition, it meets once a month on the second Thursday of each month for 30 minutes. I will send out more information about this in an email you'll get after the call tonight. And if you're interested in joining, please just reply to the email and we'll make sure that you have the calendar invite and we hope to stay connected with you in that capacity. So now we're going to do a Q&A. I will facilitate to the best of my ability, but I think Rachel and Wendell are going to answer most of the questions. I do want to give an opportunity to Matthew, who I saw had his hands up earlier. So I think, yeah, it was Matthew Stevenson had his hand up earlier. So Matthew, if your question is still top of mind, I'm going to let you go first. Before I go to Matthew, please use the Zoom raise hand feature. If you have a question, to raise your hand, you click on the react button, which is the little heart at the bottom of the screen. And then there's a button that says raise hand, and I'll get to you. So with that, I'll pass it over to Matthew for his question.
Oh, it's more of a thank you to, I think, Spencer, I've gotten an email from you, Wendell, and Melissa. I've read your work, and I've cited it in myself and several hundred VA physicians and veterans have cited it in an open letter to Congress and to the Secretary, sort of basically blowing the whistle on this long-standing but rapidly accelerating push to turn the VA into an insurance payer with United Health and TriWest as intermediaries for private sector care, which the evidence shows is less effective, more expensive, and due to that expense will inevitably jeopardize veterans benefits in the future as fewer. And so I want to thank you guys because our letters cited some of your reports. Wow. And I would love to continue connecting with you because I think there's more. I think you know more about just where the bodies are buried and how deep this goes, and maybe more than anyone out there. And there's a growing coalition to push back firmly against what's happening. And I think you guys are a natural coalition partner.
Thank you, Matthew. We really appreciate that and certainly appreciate a kind of different lens and perspective related to veterans issues. And please always feel free to reach out to us at our email. So we'll go to Julie and then Ellen. Julie, what's your question?
Hi, can you hear me?
Yes, ma'am.
Yes, good. I put this in the chat, but because there's specialists on this call, could you please answer one question? I've been told that in Medicare Advantage plans, that when they get the per capita amounts sent to them, when the doctors upcode, and a certain amount per patient is given over from the government to the Medicare Advantage plan in order to pay for care. for all of those per capita amounts that are sent over to the plan, is there a law that forces them to use the money for the person, or does it just go into a general pot for the entire per capita amount, no matter how small or big it is, and it goes into a general pot and they don't have to use it for personal care for that patient?
That's a great question. So essentially, it does go into more of a general pot rather than it's earmarked for that patient. It has to be used for that patient. Legally, Medicare Advantage plans are required to provide medically necessary care and everything that's covered by traditional Medicare. But what they have started to do is implement those things like prior authorization, like step therapy for the prescription drugs, like narrow physician networks. And that's how they are legally denying and delaying that care. And then they're not spending the money in that pot on that care, and they can use it on things like, buying back billions of dollars in their own stock and things like that. So it's a great question. And, legally, they are required to provide the same care that traditional Medicare does, but they've come up with all of these obstacles to get around it.
Okay, thanks.
Thank you. And I think one quick clarifying question from the chat, Rachel, on that is please clarify if per capita is for traditional patients or for Advantage.
So per capita is for Medicare Advantage, and then traditional Medicare is based on fee for service. So that means, you go to the primary care doctor for one visit, and then that primary care doctor is paid a fee just for that one service.
Great. Thank you. Let's go to Ellen and then Jessica.
Yeah, hi, thank you so much for this call. My question is, many people have pointed out that the bigger Medicare Advantage gets, then when we speak about Medicare for all, if we ever get to that, like Medicare will be gone, right? It'll be like all privatized, right? So I'm wondering if this bill that tries to, restrict vertical integration, how will that help? Is there a way that can help push back against the growth and consolidation of Medicare Advantage? Because it seems like it's really a creeping problem, destroying the little bit of a public system that we have.
Ellen, I will start, and I think yes, the answer is yes, because what we're seeing now, particularly with United, but also CVS, which owns Aetna, and other companies, because of their vertical integration, they are making considerable money by being able to steer their Medicare Advantage enrollees into entities that they own. It's just another way that they're grabbing more money and capturing it and being able to reward their shareholders. So if this were to not be a possibility for them, the Medicare Advantage program for these big companies would be less lucrative. When the Medicare Advantage program was initiated back in 2003, there were a lot of plans that were participating. Many of them have been bought by the likes of United, so there are fewer participants. And also we're seeing that these companies are actually dumping a lot of their Medicare Advantage enrollees now, and as we look into next year, because they're not profitable enough. So we may see a bit of shrinkage in the total enrollment. It may dip below 50% next year as these companies do that. But that's more than you asked for, Ellen.
No, that's helpful. Yeah, thank you.
Great. Jessica and then Deb.
Hi, can you guys hear me okay?
Yes, we can.
Just quick question. Does this also include all of behavioral health? I'm a behavioral health therapist, and we've been significantly impacted, in this. And also, I guess, kind of wondering if there is part of this bill that also is protective to the providers that are being taken advantage of as part of all of this as well. I don't know if people know, but when United Healthcare Clearinghouse got hacked, a lot of therapists did not get paid for a significant amount of time. They offered them short-term, high-interest loans for 45 days instead of just paying them the money that they owed them for the claims for their work, which still wasn't enough time for that. So, and then we have middlemen like Alma who helps to I guess, be the middlemen between therapists and getting insurance claims paid higher, which I just found out recently Optum also owns. So that was kind of a question and statement, I guess.
That's a great question. So the bill does include behavioral health and mental health providers. It includes all outpatient medical providers and Medicare Advantage providers. The only situation it doesn't include is things like Kaiser Permanente, which is a hospital system with its own insurance plan rather than being one of these giant conglomerates. But behavioral health and mental health providers will be included. In terms of protecting physicians and providers who have been taken advantage of by United Health Group, the bill doesn't do a ton explicitly. I think there is a lot of work to be done in that situation. It does require divestment, so it, doesn't allow the providers that are already owned by United Health Group and others to continue to be owned by them. It requires that they divest, but I think you're exactly right, and we need, some more innovations to help providers be able to stay independent.
Yeah, yeah, awesome. Thank you so much.
Thank you. Let's go to Deb and then Michelle.
Hi, this is not a question, but I cannot find the toolkit that you posted.
Deb, I can drop it in the chat now, and I will email it to you after our call tonight.
Okay, thank you so much.
Promises. Of course. Thank you. Michelle and then Robert.
Oh, hi, Spencer. Thank
Michelle.
you. I just wanted to, Medicare, I call it Medicare disadvantage fraud, but there is a plan, the whole purpose of Medicare disadvantage has been to privatize traditional Medicare. They've been trying to privatize Medicare since the time it was introduced. And I want people to know there's a plan that's proposed by CMS, the Centers for Medicare and Medicaid Services, which is a betrayal of the people and of the original intent of Medicare, but it is supposed to take effect January 1st next year. And it's called the WISER, W-I-S-E-R plan. And it is supposed to introduce pre-authorization into traditional Medicare. It's trying to make Medicare, traditional Medicare more like Medicare Advantage, which is what they've been trying to do for years, So they've been trying to privatize Medicare, but I just want people to know about that. And I just wrote in the chat that I have a podcast titled True Seekers Health Justice. And there's a podcast titled Medicare Disadvantage Fraud, Bleeding the Medicare Trust Fund.
Appreciate that, Michelle.
But I think our legislators need to hear from us that we do not want to privatize Medicare. We need Medicare for all, not privatize Medicare for profit. Thank you.
100%. Rachel, do you want to talk a little bit about the work the center's doing on WISER?
Definitely. So we have been really pushing against the WISER model. We have written a few pieces on our separate Substack called Healthcare Uncovered about why the model is so bad. We also worked with Representative Pocan's office to introduce a congressional resolution against the WISER model and saying that it should not be implemented. There's also an exciting update on the appropriation side that we have been pushing. And in the House, this gets a little bit into the weeds, but in the House, they passed a bill in the committee that said that CMS would not be able to implement the WISER model. We are not sure if that will be passed through that full House and the Senate into law, but we are working on all fronts against that model as well. And we totally agree, Michelle.
Thank you.
Thanks, Rachel. Let's go to Robert, and I think Robert's going to need to be our last question for the night because we are at the top of the hour. So Robert, I'm going to go to you, and then I'm going to close this out.
Yeah, great. Just some comments. Number one, I'm a pediatrician. I would urge healthcare professionals of all kinds become active in your professional societies. Getting their support, or at least educating them, can be very effective. The other thing is showing up in white coats or scrubs at any demonstration as a group can be very powerful in attracting media and individual attention. Thank you all for this. Bye. I'm done.
Thank you, Robert. I appreciate that. And I think that's a great note to close us out, to a call to action. If you're a physician, get out there in your white coats. If you're a patient, consider, I've worn a hospital gown before to show my identity as a patient. Nothing like a visual impact from a protest. So thank you, Robert. So one last call. If you have not already, if you want to be connected by email with other people in your state or in neighboring states, please put the number 1 in the chat, and I will go ahead and get all of you connected either tomorrow or early next week. Again, we are continuing to plan this campaign, and we appreciate the chance to be in communication with you all about it. We'll be in touch, and we hope that you get in touch with us. Our email address is advocacy@centerforhealthanddemocracy.org. That's the email that I'm going to use to email you tonight. So save it, put it in your contacts, and reach out to us when you want to help. When you have questions, when you want to plan actions, when you want to strategize together, if you have creative ideas to share, shoot us an email. Let me just double check my notes. We will send you the activist toolkit as well as a one-pager about the Patients Over Profits Act. I put both of those links in the chat, but we will get those over to you tonight. And lastly, big thank you for being here. Appreciate you taking a little bit of time out of your Thursday evenings. We're not going to hold you any longer. So just thank you for taking an hour to learn about this issue, co-plan, and get to meet some new folks. Have a great night. Thanks all.
Thanks, everyone.